Welcome to The Briefing, a co-production of The Appeal and Now This. Today, I'm excited to be joined by our guests, Allegheny County Council Member Liv Bennett and Boston City Councilor Michelle Wu, as well as Dr. David Rossman, President of the Massachusetts Medical Society. Today, we'll be talking about racism as a public health crisis. This past Tuesday, the Minnesota State House of Representatives Rules Committee voted to adopt a resolution declaring that racism is a public health crisis, with the House vote next week. Minnesota could join more than 60 local and state governments that are considering or have already passed resolutions declaring racism as a public health crisis. The NAACP Legal Defense Fund notes that structural racism is the underlying condition behind COVID-19 health outcome disparities. The prestigious medical journal, The Lancet, published a report from public health experts and echoed by the Dean of Harvard School of Public Health, calling for coordinated public health-focused efforts to take on structural racism. The structural racism that is killing Black Americans across the country. Rolling Stone recently described individual cases during the pandemic and the systemic deprivation of health, wealth, access to education, housing, jobs, and more for generation after generation. Media and government attention has grown around the fact that although the pandemic has shut down the country, it has not stopped brutal police violence or police killings of Black people. The movement to treat racism as a public health crisis has been around for a long time, and the traction recently gained has shifted conversations across the country. More and more elected officials are taking the discussion seriously. Today, we're happy to welcome two officials who have helped lead local efforts to treat racism as a public health crisis, as well as a medical expert to give this problem some much needed context. Liv, I'd like to start with you. Thank you for joining us. You introduced a motion declaring racism to be a public health crisis in Allegheny County, Pennsylvania, which includes Pittsburgh. The motion passed along party lines. Pittsburgh City Council passed a similar bill. Can you talk about some of the reports that you relied on and what ways you've seen structural racism impact your constituents in Allegheny County?
So thank you so much for the question, and thank you for having me on the briefing today. I'm very happy to be here. And so, yes, we did declare racism as a public health crisis in Allegheny County in May of 2020. This was a move that actually resembled what our city council, Pittsburgh, did in December of 2019. And what prompted both of those actions was the gender equity report that came out of the University of Pittsburgh in partnership with the mayor in Pittsburgh, the city of Pittsburgh, for the gender equity report, which showed that for Pittsburgh, and by greater context, Allegheny County is the worst place for Black women to live in the country. So the report found that if Black women moved to almost anywhere else in the country, they would have better outcomes in housing, in healthcare, in access to jobs and education, and they would have better outcomes for their children. So based on that report, we knew that there was something that needed to be done. We have had reports like this previously, dating all the way back to 1969 that I know of. And so it just seemed as though we continued getting the same information and having and outlining the same outcomes, but we weren't doing anything to actually change that. So with declaring racism as a public health crisis, this was our way of trying to do something about it than just diagnosing that there is racism in the region. So what this is going to look like is now at the city level, we are constructing tables based around the pillars that were outlined in the gender equity report. So health, poverty and income, employment, and education. Of course, we can figure out a lot of other things that we can include in those tables as well. Right now, there's going to be one around policing because of the what's going on nationally. So that's the idea, is to actually use the information that was given to us by the study and then create tables and to actually drill down to try to solve and make sure that we are bringing about better outcomes for African Americans and just everybody in Allegheny County.
So you mentioned tables. How do the tables work? What are the next steps? How are you going to get to the actual outcomes with these tables?
So that's looking like, so at the city level, we have at city council, what the county did basically is just say, okay, the city is ahead of us in this work and we need to do this work collaboratively because at the county, of course, we have the health department and we have other agencies, the jail, that just are not controlled in the city. So we're going to have to collaborate and work together other than the city as part of the county as well. So what that's looking like is that the city is developing a commission, which will be developed with elected officials. It'll be administrative looking, and then out of the commission will come these subcommittees. So we have tables. We have an All in Pittsburgh table, which is looking at equity. We have a doctor's table that's looking at the health outcomes. We have an economic table that's looking at how we can fund and really accelerate Black business and entrepreneurship here. So these different subcommittees are going to be from the community leaders and people that are already doing this work in these different areas. And we're bringing them to these subcommittees to actually bring about policy to create the change that we need to see in this region.
So what's the timeline for this? The tables come together, community gives input. What do you expect? When do you expect to see these changes? Because there's an urgency here, not only in Allegheny County but across the country.
Absolutely. So just to give you well, the timeline that kind of came about, and I would kind of guess it would be about the same timeline. We received the gender equity report in September of 2019, and we out of that report came a gender equity commission, and they just submitted their final recommendations to the mayor, I think like maybe a month ago. So not quite a year. And we think that we can get that same type of work and turnaround through these subcommittees. And again, I don't know that we want to, just put a stopping point like the Gender Equity Report, Gender Equity Commission. Their real goal was to give policy recommendations. And I don't know, if they're going to stop their work there or if they're just going to continue and try to work around some of more equity issues. But that's kind of what I would like to see, is not just to have a deadline, because we know that some of these things change and they morph into different things. So as that happens, we need somebody to be able to catch those things early to keep it from being something, used systematically to oppress folks again. So we know oppressions can morph and shift. We see that in racism, from Jim Crow to redlining to mass incarceration. So we just don't want to erect the table and say, okay, our job is done, when then something else may be created and there's maybe a need to address that. So my goal would be to keep this an ongoing thing, to make sure we never get back to a place where we're the worst place for Black women to live in the country.
Thanks so much. That makes sense. One quick question. For folks that are looking and don't pay that much attention to local elected office, can you please explain the difference between Allegheny County and the Pittsburgh? What's the difference in jurisdiction? Could you break that down a little bit?
So Allegheny County has about 130 municipalities, and Pittsburgh is one of them. So Allegheny County obviously is the greater portion. The county is the greater portion of where the city resides. So Pittsburgh is just one county or one municipality within the 130 county municipalities in Allegheny County. But Pittsburgh has a large population of Allegheny County. So things that come out of Pittsburgh are kind of, model setting, I guess, for the rest of the county, because the city is just so large in its demographic and numbers. So that's kind of how it works here. It's a little, Philly, for example, their city and county are one. They don't have these different levels of government. Allegheny County is a little weird and different. I think it's, just people want their own autonomy. So if we can erect 130 different municipalities, so everybody has a position, that's what they did. So it makes it a little difficult to get things done at times, but it is what it is.
Thanks so much for that breakdown. Michelle, I'd like to bring you into the conversation. So you've been pushing for changes that will confront systemic racism, including defunding police and putting money into communities instead. This past June 12th, Mayor Marty Walsh issued an executive order declaring racism a public health crisis in Boston. But 2 weeks later, as we discussed last time you were joining us on the briefing, his proposed budget did not satisfy what you and others were calling for on police budgets, and you voted against it. How have you seen conversations on racism and public health play out since Mayor Walsh issued that order? And has the order helped, and what more is needed?
So first, I want to also say that it's just such a joy to be back, but also an honor to be on with these incredible panelists and guests. So I'm really excited and loved what Councilmember Bennett just had to say. I think in Boston, it's important that we name it. It's important that we put it out there and acknowledge it and set the vision as much as possible from government. I do think that the understanding that racism is a public health crisis was, the declaration could have been made much earlier on during the pandemic, way before the pandemic as well, right? We know Boston, like other cities, but particularly here, the depth of inequality, of segregation by neighborhood, the disparities by life expectancy, educational access, transit access, all reinforced by policy. So we know that this has always been the case, and the just saying it so doesn't change. Doesn't mean that the problem is new. But in making that declaration, there's some little practical things that happen. Right, the city has a little more authority and flexibility to issue contracts and decide where that city spending is going to go. We also try to set the stage for those outside government, right, those in the private sector and in nonprofits to also be on the same page. But what's really important to note is that this mayoral declaration came, I think, second week of June, right, after the murder of George Floyd, Breonna Taylor, so many others, after the mass activism around that. The city council had in fact already had this on the table back in March, thanks to my colleague, Councilor Ricardo Arroyo, who made this his very first statement from the council floor as a new member to say, we need to do this. And not only do we need to say it, but we need to put the funds and structural changes into city government to make that happen, to have an independent office to assess the racial equity impacts of every action that city government takes, every policy that we do. But we're not there yet. So I think there's still a lot more to go, even on the government side, but it is important to say it and then say, we're going to put all our energy towards this.
So yeah, what more needs to happen on the government side? Like, what are the next steps? How can you get some real changes?
Yeah, I think it was painful to be discussing the budget so recently after we had gone through that back and forth, when we hear a lot in Boston that the solution coming out of City Hall is funds that are created, which we desperately need more resources going to Black and Brown communities. It is often a matter of life and death to get these resources. But when we say that what we're going to do from government is just to fundraise and distribute this, we are missing out on the opportunity to really channel activism into structural change, right? The whole city of Boston budget should be $3+ billion of a racial equity fund, right? The way that we spend every taxpayer dollar when we're contracting out in the community, we should have higher numbers than just 1.8% of COVID spending going to local so-called designated minority business enterprises. We should be carrying that out in our schools, in how we regulate zoning and development and who gets to build and how our communities are shaped. So there are many structural ways that is unique, that only government and only city government can do.
Michelle, you recently joined a number of elected officials across Massachusetts to talk about the role of Asian American and Pacific Islanders and leaders in confronting systemic racism in America. And this also in California, for example, there's always been attempts to kind of pit groups against each other, Asian Americans again, right? So I'm interested in how you've seen some of these conversations evolve in the AAPI communities.
Yeah, I was proud to be part of this group of 30 plus AAPI leaders across the state who came together and said, we're going to make a very strong public statement from the heart to our community in support and in solidarity with the Black Lives Matter movement. I think this time, the pandemic has been really tough for the AAPI community, right? We were among the first to feel very targeted, perpetuated by President Trump's racist language, xenophobia, and businesses, for example, in Chinatown and other API communities felt the economic impacts of racism and xenophobia even before the virus was really in the United States. But in the wake of a national conversation and such urgency around tackling systemic oppression and systemic racism, we also need to understand as Asian Americans, as AAPI residents, that we are part of a system, right? That it's not about a hierarchy of pitting an individual's experience of discrimination versus someone else's and who ranks where, but we are all part of a country that from its very founding has said not everyone is worth the same, right? Not everyone is valued the same. And for many of us, with immigrant family backgrounds to come and become part of that later in our country's history, it is important, it is necessary for us to understand where we fit into that, how we have been pitted against Black and Brown communities, the model minority myth, with the perpetual foreigner myth, stereotypes, and to say in this moment, we're not going to let that happen. We know that we have been empowered and enabled to immigrate to this country precisely because Black activists stood up and said, it's not going to be just for us, it's going to be for everyone. And so in these moments, we can't say, well, it's not exactly our issue. This is all of our issue. We need everyone in the fight against racism. And, I think in our community, we need to step up more and feel that this is our fight. We need to be in solidarity following the lead of Black leaders.
Appreciate you stepping up and taking the lead on this. It's really important. I'd like to bring in Dr. Rossman. So David, thanks so much for joining us. On June 1st, you issued a comment on behalf of the Massachusetts Medical Society that said, quote, systemic racism in and of itself causes illness and premature death for people of color. For those who haven't been following this conversation, what does that mean?
Yeah, so thanks again for having me. I'm so proud to be on with you and council members Wu and Bennett. If you go far enough back in the medical world, race was seen as a genetic rather than social construct. But with the Genome Project, we know that to be false, right? In fact, there was a journal article 20 years ago in the journal Genetics, which showed there's a greater difference between two Africans than there are between Africans and Eurasians. And the sun doesn't revolve around the earth, and differences in races is not due to genetics. And so then people would try something else in order to be racist, right? They'd shine a light on behavior, unhealthy eating habits, or bad choices. And it was only recently, frankly, that the medical community, much like the rest of our country, is waking up to something that's 401 years old in the US, and that's that it's racism, systemic structural racism that causes illness and premature death for people of color. So numbers, right? If Black women are 22% more likely to die of heart disease, and yet they actually have in the AHA, the American Heart Association system, they're considered less at risk for heart disease. And so the system is structured to pull care away from them. 71% more likely to die of cervical cancer, 40% more likely to die of breast cancer, 3 times more likely to die of pregnancy-related causes, or if you're over 30, 4 to 5 times more likely to die of pregnancy-related causes. And their babies, Black babies, 2 to 3 times more likely to die before they take their first step, before the age of 1. Right. So, and yes, there are components of systemic racism that causes poverty, and poverty in education plays into this. But a high income Black woman with an advanced degree is still more likely to die or experience the death of her child than a poor white woman who hasn't graduated from high school. It is systemic racism that causes these problems. It is built into our system in the fact that Black women, Black men, less likely to be treated for their complaints, their pain, less likely to be taken seriously. The guidelines that exist within so much of medicine, whether it's with in cardiac care, heart care, or many other parts of the body, almost every part of the body, in which they divert care from people with Black and brown skin. And if you look at David Satcher was wrote an article 2005 as Surgeon General entitled "What If We Were Equal?" He noted 85,000 excess deaths per year because of race, and if written today, we'd say racism. And that was 15 years ago. So the math says 1.25 million Black men, women, and children have died in excess because of their race. And what we know, actually, looking at the CDC's Healthy People 2010 and then 2020, the numbers are getting worse. The disparities are getting worse. So that's what I mean. The color of one's skin is it's a holocaust of racism.
So those numbers are staggering. And it sounds like we've known this is a problem for a long time. How are things evolving? Like, what's the next step for doctors and in healthcare generally?
So, there's a lot to be done. And I'm hoping, I think as everybody on this call and perhaps who's watching it might today, that things perhaps are changing. I wonder whether or not, the isolation and separation of COVID has somehow brought us together a little bit more, so that the solidarity created around the murder of George Floyd and the murder of Breonna Taylor somehow resonated more in the white community than did the horrific asphyxiating murder of Eric Garner, which didn't garner the same amount of attention. So the hope is that we are actually moving in the right direction. We need organizations like mine to take a hard look at how to become truly anti-racist. So we at the Mass Medical Society are doing so along 4 axes. First, look in, right? And I think this should be a model for every organization, which unfortunately, nearly all of them dominated by white people. Look internally at membership, governance, leadership, identify how it is that we can actually create equity. In the places where we work, for a physician, work to end the everyday abuses, microaggressions, underrepresentation, lack of promotions, inequity in payment, racism, I've got a colleague, a young Black woman with a resume that is professorial, 100 times what mine is, and she remains an assistant professor. If I had her resume, I'd be dean of the college at this point. And it's the reality of the differences of expectations and the racism in those expectations. Medicine so often focuses on the downstream health consequences, all the numbers I mentioned, the heart disease, obesity, and cancer. But we need to be looking upstream. And thank you, to Council Member Wu, who's my council member, and Council Member Bennett, who are looking at the food and the housing and all of the different components that are part of the structure within that structural racism.
Thanks so much, David. I like to open up broadly to the panel. And my first question is, we've talked about generally the health disparities, all these disparities. In this moment, right, with COVID-19 that raging, what can we do now? Like, what's happening to address some of these disparities now that are killing people every day in all of our states? We can start with you, Liv.
So for us, I know there's been a lot of push on mutual aid. I am a part of a coalition with other Black elected officials, and we've been really advocating just for, the equity. At the beginning of COVID, we didn't even have testing in our communities. We had a lot of folks in our communities just did not have access to go get a test. Where were they getting a test? There was a lot of non-information. So we really pushed to bring about equity in that and making sure that facilities that service communities that are mostly Black or people of color or underserved folks had testing there. We recognized that there were businesses, a lot of Black owned businesses who don't have the structure of a, quote unquote business that weren't able to access these PPP loans. So just these types of, these things as they were coming up, and is not that these issues weren't there before COVID, it's just that they were very much highlighted through COVID. So we, because we've had this Pittsburgh Black Elected Officials Coalition, we were able to really, pull together and really just go and try to leverage our offices and our networks and connections to really bring about some equity, or at least bring some resources to our community where there were none. And then again, with food, we've had many food distributions. We have folks who really did coordinate a lot of mutual aid. A lot of our food distributions were drive-ups. People who don't have cars, how are they going to get food? So we've actually had to create a system. Sister here created a system where folks with cars were picking up food for folks without cars. So it was a lot of that. It was a lot of community coming together, people fitting in where they get in to try to solve the gaps that we knew that were going to be there and were there due to COVID.
Thanks, Liv. Michelle, you want to jump in on this one?
Yeah, I would just add, there's much of that being done by heroes here in Boston as well, and making sure that in this immediate crisis, needs are being met and relief is being given out and provided. I hope that we're also, especially from the government platform, thinking about how to meet the moment with structural change, right? So, things have been either paused or kind of broken down. And how do we make sure that we're not just thinking about, getting back to where we were before, but really rebuilding, reconstructing in a way that is actually sustainable, actually resilient, so that next, weather disaster, whatever it is, it won't be as great. People will have the financial stability, have the strengthened community to be able to make it to adapt. I think about transportation access, right? We've had a chance to completely rethink who needs to get where and how we are connecting people. Our MBTA system, our public transit system has been free in terms of bus service because it's been safer for folks not to get on and tap their cards and all be together to space apart. How do we make sure that we're carrying that forward? And we talk about economic mobility and climate justice. Our schools, right? We've been going through a remote learning period. A lot of learning loss happened, exacerbating inequities. How do we make sure that we're not just figuring out how to, go back to school with people sitting further apart or cleaning the surfaces more, but rethink what it means to really have equity in our school system? And then our public safety and public health system, right? It's been impossible, if you didn't know it before, right? It's been impossible to look away from just how much we are failing in our public safety and public health systems. How do we rebuild, not back, but in a way that truly includes everyone?
Now, Michelle, you also, sorry, David, you were gonna add?
Oh no, I just those are two phenomenal answers, and the thing that we need to do at the same time, at least from a healthcare system perspective, one is the pipeline, right? 13% of the population is Black, but about 6% of the doctors are. In fact, it's fewer Black male doctors are graduating this year than 40 years ago, and stunning, unacceptable statistics. And then within our professorial ranks, teaching in our universities as physicians, it's under 4%. We have to fix our pipeline. We have to fix our promotions and equity and payment, and then all the way up through the leadership in order to be able to move our future the way that it should go. And then the other piece, as the white face on this, right? One of the immediate things to do this is to end white silence. Constantly, there are white faces in a room where there are only white faces, and we need to be talking up and speaking about that. There are white faces where a comment is made and a microaggression or abuse of one member of the team that is of color, and we have to speak up against that. There is to be an ending of the white silence as an everyday activity as part of the way that we're defeating structural racism.
Thanks so much, David. I'd like to turn back to something. So, Michelle, you mentioned this idea of a fund and money and the role that money is going to play in kind of addressing these disparities. So, a new report from the Justice Collaborative Institute by Professor Monica Bell proposes a racism response fund that will provide people subjected to racist acts with monetary compensation, as well as services and care. So, my first question is, do you think this is a good idea? And would you propose a resolution toward developing a racism response fund We can start with you, Michelle, and then turn to Liv.
Yeah, so we've been having a conversation about the role of funds in Boston, and it's a conversation not just about the need and how to meet it with resources, but also about the structure and the process and the oversight in terms of how that happens, right? So, just in a general sense, there's been a lot of harm over the course of our country that we have not addressed, and whether it's a direct conversation about reparations, a fund set up, a response fund set up, we need to repair a whole lot, at every level in our society. My concern with the situations that we've seen, for example, in Boston, where we have the political arm of the city, right, using city government as a platform to solicit private donations from corporations and individuals, and then for the city to decide who gets it out of an application process or a lottery or whoever, when you're keeping the power over distributing all those resources through a political, route without democratic oversight, and now not starting by defining what's the scope of the problem, right? What is the amount of resources we need to actually help everyone, but what can we cobble together through this really, in some ways corrupting process of private fundraising flowing through city hands, and how do we, what's the least unfair way to get that out to people? It just distorts multiple processes. There's appearance of conflict of interest, if not actual conflict of interest. Do I think we need more resources? Absolutely. Do I think that could live in community? That could be an independent fund that city government supports, directs people to. Yes, I think there are resources on the table that we all have a role to try to generate and direct towards Black Americans, towards Black and Brown communities, especially in this moment. But we have to be careful about who's in control of that and what the oversight is.
Thanks, Michelle. Liv?
I'd absolutely agree with that, because that is what we see here. For me, it's really about trying to deconstruct white supremacy and white privilege and all those structures. So in those structures, you tend to get folks who, in these processes, that the same people are called to the table, the same people are getting access to these funds, and you're missing the folks who actually are doing the work and probably need the funding the most. So how does that look? How do we figure out that look? That's the challenge, because I know here we actually created, out of the protest, we created a fund to pay organizers and Black folks that were doing labor, and mostly were not being paid. And that and it works, but I don't know how sustainable that is, because it's a Venmo account. So, that's not very, it's not very direct, or it's not, it's not long term. You're depending on who's giving to it to be able to disperse. But so how do you do that in government? How do you make sure that the people that actually need the funding are actually getting the funding? The people that are actually doing the work are getting that funding? Because what we see here is that folks get funding and they claim to be doing this work, but I don't see them. And I live in a neighborhood that's underserved. So I'm front row firsthand. So you can't tell me what you're doing in my community when I'm right here in the community and I don't see you. And these are the people that usually are getting funded for work that they aren't truly doing. So I don't know what the solution is, to be honest with you, at this moment. But I do know it's a problem that we do need to address and figure out how to best make sure that we're funding the right people.
Thanks, Liv. David, any final thoughts before we close?
Well, first, I just want to thank you so much for this opportunity. It really has been incredible. The only statistics that I didn't talk about were the COVID statistics, and they really are the immediate ones. And they talk about what we need to be doing in this situation, right? So, if you think about the people who are living in majority Black communities, they are three times higher rate of COVID, 6 times higher rate of COVID death. And both of those numbers are incredibly appalling. One, that it's a higher rate, but then that it's an even higher rate of death tells you about the disproportionate healthcare that happens even after the higher risk. 41% of the of frontline workers are Black and brown, and less than 1 in 5 Black people and less than 1 in 6 Latino people are able to work from home. And so COVID is a devastating effect on the community. And as I will also just add one more stat, which is, although we think about this as a disease of older people, the death rate for Black Black people 35 to 44 is 9 times higher than for white people in that same age group. Unbelievable statistic. And that one's from Dr. Mary Bassett from Harvard, who used to be the Commissioner of Public Health in New York. She does some amazing work. And so I just want to say that the disparities in COVID are so incredibly high. And Councilmember Wu was talking about how we need to think about education and prioritizing. We absolutely need to be thinking very aggressively about how we prioritize. And ultimately, when we end up prioritizing in education, which we're going to need to, the people who normally get prioritized, that's my kids, should not get the early chance, right? They're not the ones who need to go back to school the most. They're not the ones that need those spots. And we need to be thinking about that very proactively going into next school year.
Thanks so much, David. Liv, Michelle, I know you have to run. Any final thoughts before we wrap?
Yeah, I was glad that he's talked about education. That's a great, it's a two-edged sword, because I see a lot of remarks around that with, bringing underserved kids back to school first. But on the other hand, it's like, okay, are you using this community as a guinea pig to figure out if it's workable to bring kids back to school? So I don't know, there might be a little bit more discussion that needs to be had there. But I do understand the underlying, motivation to make sure that those who would not be, that don't have the access would be first to get the access. So I do understand that premise. But one last thing I would like to leave with is that part of the disparities is because we just don't have our numbers and our representation in this country. And how we do that is through the census. So I would just like to remind folks that part of equaling out the disparities in our country is to be counted. And if everybody wants to be counted, they can do their 2020 census online, 2020census.gov. We really are pushing that because large numbers of African Americans are left out of being counted every 10 years. And if you're not counted, then how are you being served? So that's my ending thought.
Thanks, Liv. Michelle?
And I would just say, this has been an amazing conversation. I'm really excited to hopefully collaborate and scheme a little bit with Liv after this about our respective areas. I hope we see this not as just a short-term thing that once we get through this pandemic, we can move on from this declaration that we're talking about today and this set of issues, that this is about what we're missing out on. Imagine the world that we could have if every single person who wanted to be contributing to our cities and our counties and our societies was fully empowered to do so without barriers put up in front of them. And so I think the focus on public health, especially because of the pandemic right now, is incredibly important, because that's the basis. Like if you're not healthy, if you need to be thinking and worrying about that, how can you have the bandwidth to do anything else? So when we give people the basic dignity of supporting their health, keeping them healthy, making it easy for them to be healthy, then we open up a whole world of opportunity for every single one of us.
Thanks, Michelle. Thank you all so much. For me, this conversation has been really informative, as we think through and reimagine all of these systems. I really appreciate it. And thanks to all of our viewers for joining us. Please tune in at 2 p.m. Eastern with Summer, who will be exploring the dangers of policing and facial recognition technology. So happy Friday, and we'll see you all soon.